Hello, my dog lovers and health-minded friends. I am here today with one of my favorites, Dr. Laurie McCauley, who is a sports medicine rehabilitation specialist who's been with us several times. And today we're going to talk about fascia and fascia treatment and how you can use the knowledge to keep your dog mobile and healthy for many years to come. Hello, Laurie. How are you?
Good. How are you doing, Peter?
I'm fine. I have to disclose one thing to everyone. This is the second time actually we're recording this session because last time I recorded, I didn't notice that the platform has changed. I logged myself in as a producer as opposed to host, and my track didn't record at all. So this is the second time. First, I have to thank you for being amazingly flexible, always upbeat, and ready to go no matter what time an hour it is in the day. And I'm so grateful for it. So thank you. I can't thank you enough for my little mess up. So we're going to be talking fascia today.
Yeah.
Fascia is an interesting one. I've been always intrigued by the body and its anatomy and how amazingly well put together it is. And also how everything has its role and its purpose. And I would love to learn, and I would love our audience to learn about fascia and what it is and how it works and how we can improve our dog's health and maybe our own health by knowing about fascia.
Absolutely. So let's start with what fascia is. Fascia is, well, there's two different types of fascia. There's dense fascia and soft fascia. Dense fascia is like if you go to eat chicken and there's that shiny layer on top. That's dense fascia. It's collagen. It's the body's support system. You said you like when dogs interrupt. She just put her bully stick next to
I love
thing
it.
that is my computer's sitting on, so it was just shaking. She's
Maybe
like,
we should actually even meet your dog because I know that you have a very very good assistant. Oh my goodness,
this is
what's his
Magic. She's 17 weeks
her name?
old.
Oh
Magic.
my goodness,
Yes,
magic,
Magic.
magic.
Come here. Hup. And then Sid.
And your other assistant, we met him before,
Yep,
right?
Sid, or short for Obsidian.
Yes,
My
yes.
amazing
Yes.
Sid.
So going back to fascia.
Yeah, there's dense fascia, which is like a whole support system. There's fascia around the brain, the spinal cord, all the organs, the blood vessels, the lymph vessels, the nerves, and everything's held together. And then there's soft fascia, which fills the interstitium. So the space between all the cells. It connects all the cells. It's like a spider web. So that's collagen fibrils. And then if you sprayed it with water, which is actually hyaluron. So if you think about like hyaluronic acid and things that we give to our pets to help their joints be lubricated. And these lines, they move and they twist and they help control fluid and they help support the whole body. And when they're not healthy, like if we're dehydrated or if we have trauma to an area, we get inflammation, it gets thick and gooey, sticky, and then fluid can't move. And then we can have inflammation, we can have edema. One of the crazy things, I'm a research nerd, you know that, is that there's studies that show that when the fascia is stuck, cancer is more likely to metastasize. Instead of the body taking those bad cancer cells and surrounding them and getting rid of them, they get stuck in places and they start to build and grow.
I'm so glad you're mentioning that because for many years, I've been convinced and I've been monitoring, examining many dogs and thousands of dogs. And I noticed when there is that stuckness, that congestion of energy, the lack of flow, that's the area that usually has more likely to come up with cancer. So you're saying that metastases are more likely to happen in that area. And I'm very much convinced that that also happens with the primary tumors when there's the stagnation. And I'm glad that you're describing the fascia as tissue that is sliding and gliding and that has to be free of any congestion and that it's super important to keep it hydrated. But also I see it as a conductor of energy, that it actually guides the energy through the body because it's an electromagnetic system, our body and our dog's body, right? So it probably plays a huge role in that. Is that correct?
I would think so. I don't know that I've seen any research on that in particular, but I know we talk about like the meridians. And when we look at the fascial lines, which are the dense connective tissue in lines that connect different parts of the body, it follows the meridians.
Mm-hmm.
So if we believe that energy flows through the meridians, which you and I do, we can put the pieces together to say, yes, this is, the energy is flowing through these lines. And when there's a disruption in that, there's decreased energy flow. You can have stagnation, you can have deficiency, and disease or inflammation can come from that.
And it's very possible that even the nourishment to the cells doesn't flow as readily if there's congestion and stuckness, because there's lack of hydration, lack of flow.
Yes.
I'm a firm believer that mobility and your job and what you do is super important, not just for moving around, but also for the organ health, for the health of every organ, and also the brain and mental health. Like, it's all really tied closely together. So how does the condition of fascia affect mobility and health? Like, what is the core kind of premise or principle of that?
Think about this. You do yoga, right? A lot of people do yoga. When we do yoga, we are literally stretching our fascial lines. If you are doing your yoga and you're stretching your fascia and getting things moving, you're literally working on your fascia.
Mm-hmm.
So with our dogs, if they don't do all the same kind of stretches, that can affect their fascia as well.
Mm-hmm.
You'd be good. Hup. All right. So things that people can do, they can take their dog. So here's Sid. Put your back feet down. Thank you, sweetheart. I know they got to be able to see your front end. Come. Every dog, every breed, if their back is straight and their neck is straight and their head is pointed, their nose is at a 90-degree angle. Okay, here's a cookie. They should be able to take their front leg and come up forward straight. Now I'm going to put his head back down where it was. Boom, right to his eye.
Okay.
Every dog, every breed should be able to take their front leg back. I'm going to slide you this way just a little bit and be able to point to, especially if it's like a dachshund or a corgi with short legs, or touch
Exactly.
their knee.
Touching would be very difficult for dachshund.
It's like, it's over there.
We grew up with dachshund, so I know exactly what you mean.
And then one more is, come here, sweetheart. Every dog, every breed, with their back straight, their pelvis straight, should be able to take their back foot, have their knee straight, and bring it right up to flatten out your back, love. There we go. I don't know if you can see it. It's right there. To his elbow. Mm-hmm. If they can't, it's either muscle or fascia. And remember, fascia covers every muscle.
When there's tightness in the muscle and fascia, is there a way of recognizing the two?
They're connected. So when we talk about myofascial restrictions, myomuscle, fascia. Mm-hmm. So it's the combination of the two. We know that fascia has about 10 times more nerve endings than muscle does. So when we're treating, we can treat the muscle, something like Rolfing or something like that with a lot of pressure. But when we use a lot less pressure and treat the fascia, we can have much faster and easier and less painful result. Not to say that Rolfing isn't amazing. I know people love it. But there are other techniques that we can use as well that can have really great results, keeping the dog in that comfortable plane. I call it melting.
So this is an interesting one because you're saying that the fascia is 10 times the nerve endings of muscle. That means that when we experience pain or our dogs experience pain, they most likely feel the fascia.
I don't know. I don't know if anybody's ever studied that. Mm-hmm. We know that the nerve endings, there's sensory nerve endings and motor nerve endings, right? There's nerve endings under the skin. That would be like in the fascia. I just don't know if anybody has done the research to check that out. I just know when we talk about fascial restrictions, it's and trigger points, it's those nerve endings in the fascia that are stimulating that muscle to go into that tiny little bit of spasm, right? So we have a tight muscle when the whole muscle is affected, and a trigger point when just a piece of the muscle is affected. And it can be anything from a little bit of a spasm to a big spasm to a non-encapsulated, so no capsule around it, but fluid-filled cyst.
So I know that most dog lovers will be curious now how to determine whether there's an issue and how do you examine. Obviously, one of them is the range of motion, and that says a lot. I injured my shoulder a year ago, and I definitely had not only muscle issues, but also joint capsule and fascia issues, because I suddenly couldn't lift my arm, and it was getting worse and worse and worse. And
That's it.
we've used combination of different techniques, from laser therapy, which you
Mhm.
teach as well, needle therapy, massage, and gentle touch as well.
Mhm.
And can you give me an idea how you address it, and also how do you decide what treatment or what technique people should seek and look for, whether they see you or another specialist or person who is experienced in those treatments, or whether they can do also something at home? So the first one, how do you decide what modality you use? And second, what needs to be done by a specialist or someone who understands, and what can be done at home?
Okay, that's a lot.
I know.
Let me take piece by piece.
I
So
should divide the questions for sure, but they kind of flow.
So let's start with, how do we know if there's a problem? If your dog can't stretch, that can be a problem. If you feel a trigger point, right? So let's do that. Let's start with, what does a trigger point feel like? So Peter, you can do this too. When you put your hand on your traps, so you're like
Okay.
in this area,
Okay.
and almost all of us will feel a hard knot or trigger point there. And
Yes.
you can put pressure on it, and you're like, yes, I feel it. That's a
Yes.
trigger point. So if you
Okay.
feel that in your dog or cat or lion or whatever you have at home in their muscle, that's a trigger point. And it can be painful to the touch.
Mm-hmm.
And in humans, we can tell they can have referred pain. So you can actually feel pain somewhere else when you put pressure on it.
Mm-hmm.
There's
Mm-hmm.
lots of different ways to release it. And honestly, that's just practice and having a whole bunch of tools in your toolbox to know which one to use. But for right now, you ready? You want to fix it?
For sure. For sure.
All right. So take a big breath in. And then as you exhale, I want you to put pressure into it, but not enough to hurt, but enough to feel it. Maintain your pressure there. Let's do it again. Ready? Inhale. And then put more pressure as you exhale. And then release and feel it.
It melts. It melts virtually.
Yes.
And this is the beautiful part, that the body responds so readily and so fast. It doesn't need to be strong, right? It's only like you kind of hold it on the edge of that maybe mild discomfort and wait until it dissolves, and then you can go a little deeper and deeper, and then at the end you're applying actually much more pressure energy in that area, and it still feels okay. Is that correct?
Yeah.
Yeah.
If you had put the end amount of pressure in at the beginning, you would have created more spasm, right? Pain causes the muscle to contract, and we don't want that. Literally, what we're doing when we're putting pressure down is it's called ischemic compression. So ischemia means we're pushing the blood out. And then when the blood comes back, it stimulates mechanoreceptors, Golgi tendon organs. You don't need to know the name of that. But it stimulates those, and they go, wow, there's a problem. Boom. And they cause relaxation. So it's like a reflex to cause that relaxation. But if you use the end amount of pressure in the beginning, it would have been painful and you wouldn't have had it work.
And it would actually tighten up maybe even more. There would be an extreme opposite reaction almost. Like, it's so interesting. The body acts exactly the same way as our clients or any human does, or dogs too. Like when we use too much force, people and dogs go the opposite, or they apply counter pressure. And this is something that we need to learn about health, about interpersonal communication, maybe even about politics and every single aspect of life. So when you're describing fascia, I think that there's an answer in fascia, and the approach to treatment that you take almost to anything in life. Don't take too much force, and just be gentle and gradual, and everything is possible.
Yeah.
I want to ask you a question that just came to mind about referred. You said referred sensation and discomfort. I've noticed in the course of 30 plus years of practice that many dogs lick their feet, or they lick their abdomen and so on. And I definitely see the relationship between, let's say, a collar that is too tight, or an injury in the neck, or something else that doesn't fit, or lumbar area can refer to the abdomen or to the hind legs and so on. Like, do you see that? And have you do you confirm that what I'm noticing is actually there?
Absolutely. 100%. So remember when we were kids, and I know you didn't grow up in the US, but we used to sing like the knee bone's connected to the hip bone and the hip bone's connected to the, and we would go up the body. It's all connected, and it's connected via the fascia.
Mm-hmm.
And when you have a restriction, so think about this, there's, you can hurt your ankle. And so you shift your weight off, and then your spine shifts. And the number one reflex in our body is what we call the riding reflex, right? It's so that your eyes are looking straight ahead.
Mm-hmm.
If your body is shifted, your head will shift.
Start tilting.
So that your eyes are straight, and then you have neck issues.
Mm-hmm.
Or you say, oh, I got, kicked by a horse, and now I have some bruising and scar tissue. Well, that's inflammation in the fascia. And then what does scar tissue do? It contracts. So it can literally pull your whole body off, pull you to one side, unless you fix it. So like we see dogs with like pancreatitis. What do? They curl their back.
Mm-hmm. Mm-hmm.
Right? Their abdomen hurts. They're doing this. And that puts stress on their back. But a lot of times what happens is the pain, the pancreatitis goes away. We fix them, right? We're vets, we fix them.
Mm-hmm.
But they stay like this. They may come down a little bit, but then you have back issues. And then because they're like this, their back legs are forward, their front legs are backwards. And then they start to have issues in their legs. And then, we see them 3 years later and we call them a train wreck because everything is messed up.
Yes.
It's just been one thing after another, and we have to peel back the onion.
And I think that people don't understand that in order to keep their dogs healthy, that they have to really continue correcting and kind of helping the body with the restrictions and making sure that it moves better. And that applies to us as well. And I've noticed that, in practice, when I saw a dog, let's say with spondylitis, that they would have more, in certain area, let's say the thoracic lumbar junction, that they would be more prone to pancreatitis or stomach even torsions and bloats. And one time I talked to a specialist, emergency specialist, and I said, do you see spondylosis, the bone kind of ossification of the spine in the area of the thoracic lumbar junction? Because in Chinese medicine, it actually relates to the stomach and pancreas.
Yeah.
And he says, absolutely, all the time. So again, those are these little signals from the body that really everything relates to everything. And as you said, it may start with the pancreas, and then the dog arches, and then it goes in the muscles, and then they stay arched, and then it goes back to the organ. So it's a vicious circle, right? And the answer to that is actually to open up the spine and improve the mobility, whether it's through your work or even some supplementation that has certain mobility ingredients and herbs. There's so many ways, and this is why I love sitting here with you, because the horizon expands.
Wait, can I interject there?
Yeah, of course.
Okay, so yes, people like me can work on people's dogs, but we're talking to pet parents here. If they want to, they can work on their dogs. And as you know me, I'm an educator. I'm going to throw a plug in right here. On August 28th, we have a whole webinar with me, but more importantly, Jan Huntingford, who is going to talk even more about fascia and teach ways that people can work with their dogs. And then we have the course coming out that people can learn about lots and lots of different ways using tools and tuning forks and all kinds of really cool ways that they can do it themselves at home without even having to go to the vet. I lectured at AVMA, which would be like the humans version of the American Medical Association, what's the American Veterinary Medical Association. I'm lecturing at VMX on fascia, which is, the largest one in North America. DVM moms. So I'm trying to teach as many professionals as I can about this, but the pet parents can do it too.
Absolutely fantastic. And I'm so glad that we have you, actually, because I know that you're really passionate and you're very productive as well. Like you told me before we started how much you recorded this week, and it's absolutely fantastic. And I know that you provide much of the information at no charge and free, and you dedicate yourself. And then the courses are quite inexpensive. And definitely, if you look at the cost of veterinary care and look at how much people are spending for trying to fix their dogs, and eventually they just end up on drugs and nothing else happens. Not always, but often. This is an amazing opportunity, everyone, to join Dr. Laurie and Dr. Jen on August 28th at 8 p.m. Eastern Time. And the webinar is going to be called Fascia Fun, Vital Points for Mobility. So we'll also post the notes or the info in the notes. And if you're watching this webinar or this recording after August 28, 2024, there's going to be evergreen version that is going to be available after this webinar. Is that correct?
Yeah, absolutely. So that everybody can watch it.
Amazing.
What I live by is empowering people, optimizing pets. I tell my clients the more, and this may sound horrible, but everyone gets it. The more I can teach people, the less I have to see them. Mm-hmm. Not because I don't want to see them, because they all love their dogs and they're wonderful, wonderful people. But that means I can help somebody else.
There's limited amount of time. Exactly. And this is something that people often don't realize, that we love doing this because we can affect more lives. There is nothing worse for me than seeing a dog on a dog walk that I know could be helped immediately. And often I kind of sass the situation out and see whether I can actually pitch in a little bit in a gentle way. People don't like to be criticized. They don't like to be told what to do. So usually I start with something like, oh, your dog is beautiful. You must love it, right? And as soon as I say that, then I can say, hey, this collar, maybe, I've learned about harnesses and I know that they're really good and they prevent neck injury. So I don't even tell people that I'm veterinarian sometimes because as soon as you say, oh, I'm a vet, I'm going to tell you what to do. It doesn't really work that way. What is your experience with with just kind of going day to day? Like, how do you feel about seeing dogs that could be helped so easily? Like, I find it so frustrating.
I find that I can, and I teach my students because I've had interns from all over the world. I teach them we can help people and we have to let it go if they choose not to listen. Mm-hmm. So all you can do is educate, right? And then it's their choice. And we can't not sleep at night because they chose not to do something for their dog. But the more we educate, the more people understand it, the more it becomes, 50 years ago, the dog was an outside pet. Nowadays, my dog sleeps in bed with me under the covers, and half the time he's got his head on my pillow, right? I wake up and his nose is like right there. I'm like, good morning, sweetheart.
It's the best. It's the best time. I just see dogs such a gift to us, to the world, because usually I'm sure that you've experienced it too, that dogs teach us all the time, whether it's about health or about life, what is important, what is not important. But in your case, and the case of rehabilitation, I'm sure that when people see the difference that you make in their dogs' lives, then they take the knowledge and they apply it to themselves. So it's like a double effect, double goodness.
Yes. So a lot of my clients are agility clients. I take care of everything from paralyzed dogs who have back issues to geriatric dogs, all the way to the sporting end, high end, World Cup or World Team agility dogs. And there is nothing more gratifying than having somebody come and say, Laurie, my dog is knocking bars, or his time is down like 2 to 3 seconds, which is crazy, right? Because dogs win or lose with 1/100th of a second. Working with the dog and having them come back the next day, like not a month later, the next day, and saying, oh my God, Laurie, he won every event he went into today. Every single one, first place. You can't tell me that what we're doing doesn't make a huge difference. And that might be like the difference between winning and losing in agility, but that might just be my couch potato dog can now jump on the couch again, or can now jump in the bed again. Or my dog who used to go for like 5-mile runs with me, we've only been able to go for half a mile. And now they're running and they want to go for 1 mile, 2 mile, 3 mile, and we can build the muscles back up, right? They feel better.
I can imagine how fun it is to see these amazing dogs actually running better and the gratitude of their people when you actually do your magic. And I've experienced how amazing your work is because you taught me about laser therapy and how to use laser at home. And we basically have been able to have Pax recover in a speed that I didn't expect. Pretty much within a few weeks, he was like a different dog. And his situation was really heartbreaking because he's a young strong dog. And when he was about 18 months, I neutered him. And about 3 or 6 months after he got neutered, he started to get injured. For those people who haven't read my blog, he started to get injured. And it took us 2 years to run across your work and learn about laser therapy and fascia treatment and all that. And we also added hormone replacement therapy, which in dogs now is super important as part of the healing process, because we know now that the absence of hormones like testosterone, estrogen, and other hormones in females leads to different injuries. Can you tell us about that? Because I know that you've mentioned that in the past.
Yeah, so I can tell you that in the research that it's shown that dogs that have early spay and neuter, or even just are spayed and neutered, are more likely to tear a cranial cruciate ligament, are more likely as they grow to have hip dysplasia, and then later on hip arthritis. There's medical things that we can see that we don't see as much in our intact animals.
And some people may think that we are promoting or suggesting that dogs should not get neutered. And this would be really problematic, right? Because there's a lot of homeless dogs and so on. So this is not to say that I suggest not neutering dogs, especially in situations where they could accidentally breed. But there are methods that actually spare the hormones, ovary sparing spay, vasectomy in male dogs. And what I've noticed as well, and in the Czech Republic and in Europe, where I spend a lot of time, dogs seem to be actually not aggressive, despite the fact that they're not neutered. They seem to be socializing really well, and they're socially adjusted. So the idea that unneutered dogs are aggressive, I think, doesn't really stand in real life. And my experience is that many neutered dogs actually start having behavioral issues, whether it's fearlessness or aggression. And the research, again, that you've mentioned suggests that the luteinizing hormone that gets elevated after dogs get neutered and spay affects the brain centers like hippocampus and amygdala. And those are the emotional centers of the brain. So there's so much that we still have to learn, but we're going to go back to the joints because people will definitely be interested in hip issues and cruciate ligament issues. Can you tell me what your opinion is?
Yeah. So let's look at pictures, because I'm a huge believer that if you see something, you'll understand it and you'll remember it more, right? And the teacher, right? So teacher and healer. So this is a normal, healthy joint. So you have bone, and then the little blue line there is cartilage. You have joint fluid, cartilage, bone. You have your joint capsule and your ligaments around here. And when you have inflammation, it can be trauma, it can be instability, it can be from diet, right?
Mm-hmm.
Diets
Mm-hmm.
can cause inflammation in the body. What happens is the joint fluid thins. So instead of being a nice thick cushion, it gets thinner. It's like having motor oil and pouring sugar in it, right? It's thin, and then you get starting to get grinding. The cells that make the inflammatory mediators, the cells that create the inflammation, live in the joint capsule. So that becomes thickened. The joint capsule is what gives the nutrients into the fluids, which allows the cartilage to get nutrition, because there's no blood supply to the cartilage. So then we start to get damage to the cartilage. We get damage to the bone. We have my little, here's our healthy knee, right? So here's the femur, here's the little fibula, the tibia, our little patella joint, or little kneecap that sits in there. He sits in the groove right there. This is the cruciate ligament. Cruciate means cross, and I can show that way up there so you can see it, that little cross. And it prevents the knee from coming forward, the tibia from coming forward. And when we get inflammation, those ligaments are literally inside the joint. So when we have inflammation in the joint, it starts to pop the little tendrils.
Like little fraying, right? Like little,
Right.
let's say if you have a leash or rope, it starts fraying and then eventually it tears.
And then it looks like this.
Ouch.
You can see the inflammation. You have damage to the bone. The cartilage wears away. There's a fat pad in here that gets pushed out and gets squished. It changes the whole mechanics. And then we get tearing of the cruciate back there. And the fascia supports everything, right? There's fascia. We talk about a periosteum, so fascia around the bone. There's fascia around the ligaments. There's fascia around the muscles, the tendons, all of that. That gets inflamed. And remember, we said the fascia helps control fluid. So those inflammatory mediators, those chemicals that are causing the inflammation, can go into the joint. It can inflame the tissue around the joint, and then you get stiffness. So if you've ever gotten up and you're like, oh, right, and you're, oh, the little discomfort in my knees, that's all inflammation, right? And then we talk about how do we get rid of inflammation? Yes, we treat the fascia. We talked about laser, right? We have you lasering packs, supplements. The number one supplement in the research for decreasing inflammation is omega-3 fatty acids. And you have a product, right? Your joint butter has omega-3s in it, right?
Yes, you're right. I've been a nutrition nerd since I was about 18. I actually cured my allergies by going to the library and looking at books on microbiotics. So I've been always really interested in nutrition. Since I started, I always see nutrition as the building blocks. Nobody would expect actually to build a bike without the parts or build a house without the parts. And our food is depleted and we are not roaming freely and our dogs are not roaming freely. So the nutrients are not getting in our body as they should be. And so that's another kind of like, it's almost like a chain reaction. You're talking inflammation, you're talking the injury of the ligament, but also when the nutrients don't get in the joint or when they're absent, when they're not available, the body can't heal. So I'm a firm believer in omega-3 fatty acids. I take 3 grams a day and I give packs good dose, double dose every day. When it comes to the mobility supplement, joint butter and joint powder, which is going to be launched in August 2024, if anyone is listening and wondering where it is, we put 13 and 15 ingredients. Joint butter has 15 ingredients and joint powder has 13 ingredients that are studied and science supported to promote mobility, glucosaminoglycans, permanent muscle, boswellia, and many other ingredients. When we launched the product, I was holding my breath because I'm thinking, okay, I put my heart and soul in it, but is it going to work? And as the reviews started to trickle in, I knew that we are on the right track. And together with you, like, this is not just about nutrition. This is not just about, rehabilitation. It's putting all the different pieces together. And again, we must not forget the importance of hormones in neuter dogs or neuter dogs and how they affect our joints and the body. I did not know this, but I listened to a podcast where a female doctor explained that the postmenopausal changes in humans actually were the basis for the dog studies. And the luteinizing hormone that actually stimulates the gonads to produce estrogen and testosterone goes up because the gonads actually get kind of fatigued and tired as we age. And the luteinizing hormone is capable of latching onto the receptors in joints and other tissue, causing inflammation. I didn't really know that, but Dr. Michelle Kutzler, who is an amazing researcher and who's done these studies, found these receptors in the cruciate ligament area or in thyroid gland and other joints and tissue. So I thought that by the age of 60, I will stop learning and just retire. But I feel like I'm just starting to understand medicine. Do you feel like that sometimes that just like comes all together?
The more we know, the more we realize we don't know.
I know that you are teaching both veterinarians and also dog lovers and pet lovers, pet parents, how to keep their dogs mobile and healthy and long living. Can you tell me more about your website and how you put it together and what people can find?
Yeah, I would love to. Thank you, Peter. So it started with, I taught the certification course for vets, techs, and physical therapists for 14 years. And then when I stopped doing that and moved to North Carolina, I couldn't not teach. So I thought, oh, what can I do? How can I help the world? How can I empower people to help the pets? And I started with a laser course. I've been teaching on laser, oh my gosh, since 99, 2000, so a very long time. And I see things different ways. So I get really significantly better results than some of the other people, just because of the way my brain works and how I do it. So I created Optimum Laser Therapy for veterinarians. And then so many, like literally 70 to 80% of my clients have their own laser. And they're like, well, you have this course. Can I take this course? And some of them did, but it's a little bit over their head.
Mm-hmm.
So I created at-home laser therapy so that the people that have lasers can get the results I have, different probe positions and body positions and things like that, and understanding how to use the tools that they have to get the best results. I created Optimum geriatric exercises. And actually, that's an amazing story. And I may have told you this, so forgive me if I'm repeating myself. I adopted Sid because I fell in love with him. And I said, oh my gosh, you have straight knees, straight shoulders, and a long back. I'm a rehab vet, right? I'm not going to allow you to have a shoulder injury, a cruciate injury, a back or psoas injury. So I created an exercise program for him so that I would stabilize all those things. And then it worked out really well. I shared it with a bunch of my friends in the rehab world, and they were like, oh my God, Laurie, this is amazing. You need to share this with everybody. So thinking, okay, well, who would need the stability the most? So we called it Optimum Geriatric Exercise, but it's literally, it's 24 exercises that any vet could take and use that for everything because it's safe, applicable for a 16-week-old dog or even younger, all the way up to a 16-year-old dog, all the way from a frail dog. I have levels in it up to for like athletes, all different challenge levels. In fact, I had Laura Fern, one of my dear friends, had an agility dog, a Sheltie, who was 9 or 10 when she started the program. And she said, oh my God, Laurie, I thought my dog was strong. She does agility, she does herding, she runs, she swims. There's a huge difference in my dog. And when she was 11 years old, she was named the 7th fastest Sheltie in bad dog agility.
Oh my goodness.
So everyone else was like 4, 5, and 6 years old. And here's this 11-year-old dog who didn't make it when she was that young, but it was after she started doing these exercises that she was able to win that title. So then I'm like, okay, well, we have it for the professionals, but we need it for the pet parents. So we have Core and More foundational exercises for your dogs, which are the same exercises, just simplified for the pet parents. And then we came out this year with Fascia 101, the forgotten organ. Hence, we're talking about fascia. And then this month, we're launching Fascinating Fascia, which will be our pet parent course that we're putting together now. That there's so much information in there, just a lot of case studies and hands-on and showing different techniques and all kinds of great things so that people can work with their dogs with their fascia. And then we have, well, I guess I shouldn't tell you because it's coming up, but in a couple months we have another course coming up that I'm super excited about.
Well, that this means that people need to subscribe to you because they can miss something very, very important. I love the story that, I would say Dr. Laurie makes the grandmas run, the grandmas of the canine world and grandfathers run like the young puppies. That's quite an amazing story. 11-year-old dog winning a title. And, you were saying that people often don't believe how weak their dogs are because, they're high levels sport dogs. But I experienced something like that myself because we got this piece of equipment, which is called Tonal at tonal.com. It's like an exercise wall that is absolutely fantastic. I would recommend it to anyone. And this is not a sponsorship. I'm just saying that because I love it. And my strength has increased by over 100% in the last 2 years.
Wow.
And now there's new research coming out saying that lower body strength, and in dogs is probably rear end strength, is super important, and it kind of correlates with longevity and overall health. So it's so important for people to be open-minded about their dogs and how much they need to not only go for walks on a flat level, but going uphill, going downhill, doing agility, and probably using some sort of exercise cushions and core strengthening and all that.
Well, it's true, right? We have the type 1 and type 2 muscle fibers, and type 2 muscle fibers atrophy as we age, so they get smaller. We have sarcopenia, right? So the muscle itself turns into first fat and then fibrous tissue, which is why you don't have bulky guys when they're in their 80s. It's a natural thing that happens, but we can slow it down. And we have the type 1 muscle fibers. So when we walk, run, swim, we're strengthening the type 1 muscle fibers. And we can slow down losing the type 2 muscle fibers by doing, in humans, would be strength training. right? Like weight and resistance training. And in dogs, it would be the targeted exercises, which is what I teach in the course.
Is there anything else that you'd like to add, or anything that we forgot in the course of this conversation?
Did we want to talk about the fact that there's, besides using our hands for fascia, we can use tools and things that make sound for acoustic healing?
Absolutely, absolutely. And I never seen you with the vibration fork or with the resonance fork. So I'm super curious and stoked about talking about it.
Yeah. So I learned through, right, because we continue to take, no matter how old we get, take courses and continue to learn. Patrice Corsicis has the course up in Oregon. In fact, I'm going for another one in a couple months on fascia and using the tuning forks and the different vibrations and the different frequencies and how to use them. And we use a tuning fork, and it's amazing. I can now, laser obviously is the most important for like getting rid of specific inflammation, right, and healing and stuff like that. But for trigger points, 90% of my clients now have a tuning fork, and they can tap it and put it on the trigger point, and literally we'll move it around. And this one has an amethyst tip on it. 20, 30 seconds, maybe 60 seconds tops, the trigger point melts.
We're getting into a realm that I didn't expect to get into, but I have a singing bowl at home. I used to obviously go to yoga, and we used to have singing bowls and so on. Have you worked with them, or what do you think of that?
I love it. I had I don't know if you know Saren. He used to come to HVMA, and I've have several bowls from him. And then Mona literally has like a whole set from him, including one you can stand in. And it's just amazing. And he did a sound healing where he like put the bowls over me, over my back, over my head. And I was vibratory. Like I was in another world for like the next 12 hours. It was crazy and cool.
Hearing you talking about tuning forks makes me kind of dive into seemingly unrelated topic, but I think it is related, especially now that not only tuning our body is important in our dogs' bodies, but also tuning our mind. And, in the world we live in, it can become really negative. And I think it's super important to be mindful and dosing the negativity in small doses if we need to hear or listen to it. But mainly actually finely tuning our mind in a positive way. And I can see that you do that. What is your practice when it comes to staying optimistic?
I've read a lot of historical books. Cold Mountain is a book that I was just talking to somebody, and I think they made it into a movie that was literally took place on my mountain, right, in North Carolina, 150 years ago. I realized I have bad days. I have bad hours, bad minutes, but I have a roof over my head. I have food in a refrigerator. I don't have to hunt. I don't have to garden. I do garden, right? And I eat what we grow, but I can go to a store. I have a car. I can hop on a plane. I have a sister who lives 1,000 miles away, and I can go see her. It's not like it was 150 years ago where if your sister lives 1,000 miles away, you will never see them again, right? I can go if I get sick and get medicine. I am so blessed. And I'm a woman who's a doctor, right? That in itself, last week I was talking to someone who's like, you realize, Laurie, if you lived like 200 years ago, you would have been burnt at the stake, right? Because you see things that other people don't see. You understand things in a different way.
Yes.
And you would have been called a witch. A woman who thinks for themselves and can figure things out. It would never have worked out well for me that long ago.
So gratitude, and making sure that what I do, and I love yoga, obviously. There's an amazing yoga teacher. Her name is Catherine Durham. She's got 300 plus classes on YouTube, all for free. Amazing teacher, just one of the best teachers I've ever studied with. I have been an avid follower and reader of Adyashanti, who is a Buddhist monk, American Buddhist monk, who's got amazing teaching of how we have to be kind to ourselves and observe our feelings and emotions and not scold ourselves for them, but just kind of be aware of them. And that's the important part. And I have a weakness also for Britain's Got Talent and America's Got Talent, because when I go to these shows, mostly they're positive, amazing people who you would not expect being so talented, right? And it uplifts me, and also how people overcome um, obstacles and difficulties in life, and severe challenges. Just the other day, my friend and I were driving along the road, and there was a guy with a doggy. So obviously, we immediately see a doggy and a guy in a wheelchair trying to wheel from A to B. So we stopped, and we realized the dog didn't have a water bowl, and we got water and some food. They didn't have anything else in the store that would be normal. So I actually got in cottage cheese, the dog, and we started chatting and realizing how good we have it, right? Like most of us, really, as you said, right? We are not living in a war situation. We have food, and we can get from A to B. We can walk. And this is actually why we are here as well, because walk-in mobility is so important. So I hope that everyone who's listening and watching will attend the webinar on August 28th at 8 p.m. Eastern Time on Fascia, Fun, and Vital Points for Mobility. And if you're watching after the 28th of August, you will find it on Dr. Laurie McCauley's website, which is
OptimumPetVitality.com. And as long as you're putting that in there, just a little plug, there's something at the top that says Learn and Go. We've got almost 100 free videos on all kinds of topics that the pet parents and the professionals would love. My way to give back and help people learn how to make their dogs optimum.
I hope that we have some veterinarians watching. And if you have a veterinarian who's open minded, please let them know about Dr. Laurie's website, because it's an amazing resort, and I'm eternally grateful. Thank you, Laurie, for being here today, for bravely coming for the second time after we lost the first recording. I look forward to talking to you again, hopefully in person sometimes. We should actually have some sort of meeting one day. Let's plan
Absolutely. I would love
it.
that, Peter.
Talk soon. Bye bye.
Alrighty. Bye-bye.